Years on for receiving COVID-19 vaccine alone, Delhi-based senior cardiologist and Padma Shri awardee became an internet superstar after his phone call with wife went viral on social media platforms. Dr. KK Aggarwal, who tried his level best to pacify the situation and explain his wife, Dr. Beena Aggarwal, about the vaccine, which she will receive on Monday. With his viral video, he urged citizens to laugh as much as they want, but get vaccinated. Today on Dialogue at Nation Next, we have Dr. KK Aggarwal along with us, and I, Gushin, will discuss COVID 19 vaccine related issues with him and much more. Welcome to the conversation, Doctor.
Thank you.
So, to begin with, it's been a week since you have last received your first shot of COVID 19 vaccine. And hence, being a doctor and husband to a wife who is also a doctor, you highlighted in the viral video a very common issue of people panicking and being worried about how the vaccine is going to react to people at large and what the repercussions are going to be. So why do you think there is a persistent fear and panic in between them even after the lockdown was there?
See,
So they were panicking.
33 people have died in Norway, 10 have
Yes.
died in Germany, 13 have died in India. So
Yeah.
in India also one orthopedician doctor has died. So in
Hmm.
total, 13 doctors come healthcare providers have died in India. All of
Hmm.
them between the age of 40 and 55.
Hmm.
All of them dying of a heart attack.
Right.
So, and the government till today has not come forward. They are only saying not vaccine related.
Hmm.
Okay, that doesn't mean that the fear is out. You need to say what happened. You
Yeah.
can't develop a heart attack exactly 2 days after the vaccine.
Hmm.
Okay. If they were impending into a heart attack, why was the vaccine given? So the
Right.
fear is genuine. So the fear
Right.
is genuine.
Right.
Everybody has a fear that I may die suddenly, which is
Hmm.
a wrong fear, which
Right.
is not the correct fear.
Hmm.
And that's the reason I opted for going without telling anybody to walk in, get the vaccine, and come back to pass on a
Hmm.
message that ask yourself four
Hmm.
questions before vaccination. Number
Hmm.
one, will I develop an allergy? And
Right.
if I will develop an allergy, what are the chances?
Hmm.
And how will I take care of it before I go for the vaccination? So all allergic patients need to be prepared so that if they develop allergy, they can take care of that. Number two,
Right, sir.
if I develop a sympathetic overactivity,
Hmm.
means this is what happened to a couple of days back to a doctor in Delhi. Blood
Hmm.
pressure shooted up, pulse shooted up. Am
Hmm.
I prone to get a rise in pulse? Therefore, I need appropriate treatment before vaccination.
Hmm.
Third, when my CRP will rise, if my immune response is very high,
Hmm.
and do I have a pro-inflammatory state? That means if my CRP is more than one, then I
Right.
need to prepare myself for the vaccine. And fourth
Hmm.
is, am I clot prone? Am I prone to
Right.
get a heart attack?
Right.
That particular situation you need to prepare. So therefore,
Right.
vaccination doesn't mean you. It's not like a children vaccination. You go healthy people. We are
Hmm.
dealing sick people getting vaccinated.
Hmm.
They need to take precautions. They need to be on treatment to prevent
Right.
that fear. And that
Right.
fear is still in the people's mind.
Hmm.
The fear will come more when you start vaccinating 50 plus people.
Right.
As on today, you are not vaccinating them. When you will selectively start vaccinating, see, Germany is in so much of fear
Hmm.
that they said we will not vaccinate anybody after the age of 75. That
Hmm.
is a national fear. In
Right.
India, there is an individual fear. So there is a
Hmm.
national fear. I don't agree with that fear, and I agree with suitable precautions.
Hmm.
Anybody can be vaccinated.
Right, sir. As much as you're educating, you've claimed yourself to be a doctor and more of a COVID educator alongside a doctor. So on one hand, there are world leaders like recently elected U.S. President Joe Biden. Then there's Kamala Harris. Then there's Queen Elizabeth. Then there's Prince Philip, who have taken the initiative of getting vaccinated themselves first, and then urging citizens to get themselves vaccinated in order to just gain their confidence as to nothing is going to go wrong. Um, if there are problems, there are people to take care of you. On the other hand, if we take an example for India, Prime Minister Narendra Modi has taken no such initiative, and where opposition has also criticized him for not doing the same. So, as a doctor and a frontline healthcare worker, what is your take on that?
I know that all the doctors who are our IMA president has taken it.
Hmm.
I am the president of Confederation of Medical Association of Asia
Hmm.
and Oceania. I have taken it. I know AIMS director has taken it. I know
Hmm.
Niti Ayog Dr. Paul has taken it.
Hmm.
What matters is important people in the society, the medical fraternity. We have taken it.
Hmm.
What it comes to the health minister, Dr. Harshvardhan, whether the prime minister takes it or not, they have to
Hmm.
take it. That
Right.
call has to be taken by them. But the prominent people of the medical fraternity, we have set
Hmm.
an example and have taken it. I don't think
So,
so. I
hmm.
don't think so. The message will go that politicians are taking it. It means it's okay. More important is the
Hmm.
medical fraternity who are advising their doctors. So if the
Right.
doctors taking it is much more important than politicians taking it.
Correct, sir. But on the other hand, if you see, he's just not a politician, he's representing our country. As a doctor, would like to justify that in order to gain people's confidence.
I think I am
Uh,
nobody to comment on that. I can only comment on the safety of the vaccination. That's what
right.
I can comment upon. I am only saying is medical doctors that every
Hmm.
person who needs a vaccine, who is afraid, he
Hmm.
has to ask a doctor
Hmm.
and take it. That
Right.
if suppose a politician takes it, I'm not talking about any a particular politician, any
Right.
politician takes it, still the
Right.
patient have to go back to his doctor and ask, am I fit to take the vaccine or not? Remember,
Right.
this is the inflammatory protein.
Right.
It's not a, it is an inflammatory protein. So
Hmm.
therefore, every patient has to talk to his doctor. Will I be able to bear mild inflammation because of the vaccine?
Right. So you have invested more than 1,000 hours, I must say, as much as research as I've done, on educating people about COVID-19, the vaccine, and other areas surrounding the disease, and various other health issues surrounding COVID-19 and how it's going to respond. On same lines, there are other people as well who have apparently started calling them as health experts and have you know could be one of the reasons of there is misleading information, there's panic, there's a lot of other stuff. So as a doctor and as a citizen myself, and you are a citizen yourself, how should we differentiate in between the both as to who is telling the truth and who is not telling the truth?
You have to go back to your doctor and listen to him. That's it. You don't have to go to the WhatsApp and what public speaks about. The
Right.
time is there that everybody, every family must have their own family doctor.
Hmm.
Let him update his knowledge and explain. You can't go
Right.
back and do a window shopping on medical education.
So
The
like you are explaining,
infodemic
yeah.
is, yes, infodemic is harmful. So you have
Right.
to, and I also tell whenever I says go back and confirm with your doctor.
Right.
I never say follow me. I says
Hmm.
this is what the news are.
Right.
Kindly, this is my opinion. Go back
Hmm.
to your doctor and follow him. So
Right.
therefore, the message has to come back to a family doctor
Hmm.
concept. Everybody has to have a faith in their family doctors.
True. So you have written a report called India's Vaccine Diplomacy, which I recently read, which I recently stumbled upon, where you have emphasized on the shortage of vaccine in our country, while the government is still persisting and trying to improve diplomatic relations with other countries by providing them vaccines and under the neighborhood policy which you mentioned. So if this
If you don't do it, China would do it. Will you like to afford China becoming the leader
absolutely
in
not, sir,
Asia?
I wouldn't.
So therefore, at
I
this
would.
moment, India is surplus of vaccines. The company has surplus of vaccines at the moment. So therefore,
Right.
why not give it to the neighboring countries? I don't find any harm into it.
So, but how prepared are we to afford this vaccine diplomacy?
There is no shortage of vaccine in the country as on today.
Right.
There is no shortage of vaccine. If India wants, India can anytime do it like Baden and build up 4 5 centers to build up the vaccine. I don't think so. There is a shortage of vaccine at the moment. People are
Right.
not coming forward. Vaccines are being wasted at this
Right.
particular moment. So India is going on its approach. In any
Hmm.
way, Serum Institute has a commitment of a percentage of vaccine to be given to the common pool of the world. India is a signatory to that. I don't
Right.
think so at this moment, if you're distributing the vaccines to other countries, means that you are ignoring your own country. No.
Right. So, Covishield and Covaxin are the two vaccines which were approved by DGCI and for the emergency use in the country. These two vaccines reportedly did not complete their phase three trials before the
No,
administration.
Covishield has done a phase 3 trial because it's nothing but a vaccine of the Britain. It has come from UK. So I don't
Right,
find they may not have completed their trial in India, but they have a
right,
trial in UK. They have a already approval in UK. Now EU
right,
has also approved it. So I don't
right,
find any hitch into Covishield. As far as
right,
Covaxin is concerned, I think
right,
government should have introduced it in India on 15th of August. It's too late to bring in phase 3
right,
trial. In a killed vaccine, I don't think so. You require so many big trial. They could
right.
have done a mini trial and launched it way back in 15th of August. That's the way I look
So,
at
do
it.
you think this could one of be the reasons of the delay or the bringing in the fatalities until now, the 13 deaths which have taken this far in the
But
country?
these deaths have nothing to do with the vaccine. These deaths have to do with a vaccine-induced inflammation. These
Right,
deaths would occur with any vaccine.
right,
For all vaccine-induced inflammation, deaths can come. Therefore, everybody who is a high-risk patient must get a certificate from his
right,
doctor whether I'm fit to take a vaccine or not. Remember,
right,
these vaccines are inflammatory producing vaccines, including flu vaccine. Any
hmm,
vaccine which increases CRP and reducing lymphocytic count can
right,
produce thrombotic state and precipitate an MI. Remember, any acute inflammation with an underlying chronic inflammation can precipitate heart attack. Here,
right,
vaccine also causes a mild inflammation. If the person can't tolerate, it can precipitate. It's a trigger. It's not the causation
hmm,
of.
right. So you come across as much I've gone through your Twitter and lot many users have hailed you as Dr. Cool. We have seen you being scolded by a wife on a live session. We have seen you receiving head massages in the middle of a webinar. To quote it as comfortable rather informal, does this attitude help you get your message across to public easily? Do viewers feel you're relatable?
I
This is what
basically
you're
go back to the level of the people when I talk to them. To the children, I am a nanu.
right.
Okay. To others, I'm more like your uncle.
Yes.
Okay. So if you are married, if you have children, I will call them as nanu se baat karo.
Yes.
And if you are unmarried, I'll say I'm your uncle. So I have to go back to the status of the people and talk to them. Otherwise, health education is incomplete.
Right. So is this what the lingo is all about? That if you've got to get your message across, you just have to come down to the same level to explain the
That,
youth,
that's
especially
a basic
targeting the youth.
That's the Vedic principle of communicating a message to 1% of the society. You go back to their level. And that's what
Right.
Saraswati says. Saraswati says you go back to the level of the lowest IQ person in the class and build him up. Everybody will build it up. That's what you have to
True.
do. That's what I'm doing.
True.
I've done more than 1,580 sessions. Keep doing
Right.
it. More than 5,000 small videos. So my
Hmm.
job is to build up very basics to very advanced in a very, very simple language.
You being a senior cardiologist who has received the first shot of vaccine now, and so what suggestion or what advice would you like to give to citizens or people at large who are suffering through heart-related diseases in terms of getting the COVID-19 vaccine? I mean, how should they be careful?
You have only two choices, either you take corona or you take a COVID-19 vaccine. Corona will kill you.
Yes.
COVID-19 complications are preventable. So therefore, if you are a heart patient, make
Hmm.
sure your CRP is less than 1, your cholesterol is controlled, diabetes and hypertension is controlled.
Hmm.
Otherwise, take your vaccine under cover of aspirin, statin, and then along with that, colchicine. Under that cover, if you take your vaccine, nothing is going to happen.
Sir, thank you for speaking to me. I am absolutely honored getting in touch with you. Had a lovely time. I wish you all the very best uh, for the future. And thank you again for connecting with me. It's
Thank
been
you.
an absolute pleasure. Thank you so much,
Thank
sir.
you.
Subscribe to Nation Next YouTube channel and press the bell icon to get regular updates from Nation Next. Also like Nation Next Facebook page and follow us on Instagram and Twitter.